Hello, I am Professor Dylan Ritchie, and this is N310A Fundamentals of Nursing 1, Module 6 here at Aspen University. And we'll go ahead and dive right into nutrition and nursing. Some of the learning outcomes that we're going to go over today, there's a total of 12 that we will cover by the end of this presentation. I'll give you a high-level overview, but of course you can go back and replay this recording if you'd like to write these down individually. But we're going to discuss the meaning of both nutrition and malnutrition. We're going to go over the smaller structures such as carbohydrates, fats, proteins, minerals, waters, and how they impact living a healthy lifestyle. We'll talk about the nurse's impact via dietary screening tools and different physical assessments, as well as, again, there are a total of 12. By the end of this, you will be able to discuss special diets to meet special patient needs, and you'll be able to talk about nursing interventions based on what nursing process you're working through, as well as other input from the interdisciplinary team. So starting off, we need to understand what is nutrition. So we have two definitions here, just a different slice of the same view. So the first definition comes from actually a nutrition book, and the second comes from your foundations textbook. So the first one is nutrition is a study of nutrients and processes by which they are used in the body. So that came from a nutrition book. Versus what comes from your text is it's the body's intake and use of adequate amounts of necessary nutrients for tissue growth and energy production. So much more in depth, and I think when we look at and dive into this deeper from the lens of a professional nurse, that second definition is really going to ring home a little deeper. So what is malnutrition? Malnutrition results from imbalanced nutrients and energy intake, and you can have it one of either ways. You can have under nutrition or you can have over nutrition. So under nutrition is under consumption of energy and nutrients, simply put, not eating enough food to intake to take in all of the essential nutrients. So you're simply not putting enough in the system to get the nutrients required, the essential nutrients. So 180 from that is overnutrition. Overnutrition is consumption of too many nutrients and too much energy in excess of what you actually need. So there is an excess of what is needed. When the body consistently has excess, it handles that in what leads to issues for multiple different organ systems, which we'll talk about here shortly. But now you have understanding of both under and over nutrition. So let's review the nutrients themselves. Now we'll spend a high-level overview for what you need to understand specifically for how this impacts nursing. So let's start with carbohydrates. Carbohydrates are commonly abbreviated CHO. So a carbohydrate is a major supplier of energy. This includes sugars, starches, fiber, and they keep the body from using valuable proteins as energy. Carbohydrates can also, if properly intook, enhance memory and learning. So it's giving us fuel to work through learning and education. So carbohydrates can be broken down a little bit further. We can look at them from the lens of simple carbohydrates and complex carbohydrates. So what's the differences there? A simple carbohydrate is just that. It's easily broken down and easily absorbed. So simple is easily broken down and easily absorbed energy. Whereas a complex carbohydrate, they're a little different in that they take longer to break down and provide energy for a longer window of time. Not as much, but they provide longer. So they're complex. Think your starches. The complex have glycogen and fiber. They take longer to break down, and during that window that they're breaking down for a longer period of time, they provide vitamins and minerals that can be used for consumption. So fiber, we've said that a couple times now. Fiber, Think whole grains, wheat brands, certain cereals, fresh fruits, vegetables, and legumes. Those are all going to contain fiber. It is recommended for consumption to consume somewhere between 20 to 35 grams a day, unless indicated differently by your provider. So now we can, much like carbohydrates, we can break down fiber into two different groups to look at. You have both soluble fiber and insoluble fiber. Soluble fiber is when mixed with water, it forms a gel and it slows down digestion. So soluble fiber mixes with water and forms a gel and creates slow digestion. On the other end, you have insoluble fiber. Insoluble fiber does not retain water. And by not retaining water, it forms bulk, which actually accelerates passage of food through the intestines, and it slows down starch absorption. So we said those starch, the complex carbs that take a long time to break down, right? Well, if the starch is mixed with insoluble fiber, it slows down the absorption because, again, insoluble fiber makes that bulk and it accelerates the passage of food through the intestine, making it in there less is long, so there's not enough time to absorb it. That should make sense. So let's move on to fats. Fats are needed for energy and to support cellular growth. In a perfect world, the human diet should somewhere fall between 20 and 35% of your daily calorie intake should be of fat. And again, this is unless contraindicated or you're on some type of special diet. We're talking from the lens of the average healthy American. So what do proteins do? Proteins aid in the development, maintenance, and repair of body tissue. Think organs, cells. An example of a protein would be hemoglobin. Hemoglobin is a type of protein. Proteins also aid in the production of hair and nails, muscle movement, nerve conduction, your digestive system, and proteins play an impact in defense against bacteria and viruses. Protein is excreted by the kidneys when we have too much of it. So this is not normal. If we were having an excess of protein, you're going to see significant more in the kidneys. And there's some certain particular disease processes that we'll go over. Water, often taken for granted. Water is vital to the human body. It makes up about 60% of the adult human body weight. So it's very important. We are 2/3 water when you look at it from that lens. And it's needed to help control body temperature. Water maintains acid and base balance and regulation through the body. It also plays a vital role in regulating fluid and electrolytes that are constantly in movement around your body system. Water is important for transporting nutrients, and it's important for transporting and excreting waste from the kidney. So water is very vital. And when dehydrated, or we have any type of fluid imbalance where we have too much water, you can see across the board how it impacts multiple body systems. Moving on to vitamins. Vitamins are needed for chemical reactions within the body from nutrients like fats, carbohydrates, and even proteins. Vitamins are broken down, much like everything else we've been talking about. There's two different groups, right? We'll talk about fat-soluble vitamins and water-soluble vitamins. So fat-soluble vitamins, we actually need to pay attention to what we're taking in. They're stored within the fat, and a little goes a long way, if you will. Your fat solubles, you can always remember from the popular saying attic, like an attic in the house, except for it's going to be spelled A, D, E, and K. A, D, E, and K, addict. Vitamin A, vitamin D, vitamin E, and vitamin K are fat-soluble vitamins. Whereas your water-soluble vitamins, these are the ones when you look on the side of your nutrients label and you see them list thousands, 1,000, 2,000, 3,000, 4,000% of your daily intake. They can list that much, and they put that much in there because the body excretes water soluble in large volumes. It just flows literally through the body. Think vitamin C and all of your vitamin B complexes. They are water soluble, and they are sent through the body much quicker than your fat soluble vitamins. And the last review we'd like to do today would be minerals. Minerals are micronutrients. They serve structural purposes. Think bones and teeth. Minerals are found in the body's fluids. Minerals influence muscle function and the central nervous system. So now you have a high-level overview of the different nutrients that we need to cover as nurses. So let's take a pause and look at some different groups and guidelines specifically for Americans. We'll go over some dietary guidelines for Americans from the USDA, and then we'll look at healthy people. So some of the dietary guidelines that we'd like to highlight today are your healthy choices from all food groups. You should eat and regularly eat from all the different groups. It's just the quality and the quantity that you have to monitor. We want to watch for calories while emphasizing fruits and vegetables, whole grains, fat-free and low-fat milk/dairy products. Your diet should also include a healthy balance of seafoods, lean meats, poultry, beans, eggs, nuts, seeds, and incorporation of some soy products. And the big takeaway is to limit your saturated and trans fats paired with sodium and added sugars. If had in moderation, all of these food groups equal a balanced lifestyle. It's just all about maintaining portions. So let's look at now Healthy People 2020 through 2030. Healthy People provides 10-year measurable public health objectives, and they add tools along the way to help track progress towards achieving them. Healthy People identifies public health priorities to help individuals, organizations, and communities across the entire United States to improve health and well-being. Now, on Healthy People 2030, this initiative is the 5th iteration, and it builds on knowledge gained over the previous 4 decades since its inception. So let's look at the impact that actual nutrition has on different body systems that we should be familiar with. So we'll focus first on your neurosystem. In layman's term, poor nutritional intake equals slower mental processing. The less nutritional intake, the lower quality intake, the slower mental problem solving we'll know. You might note a patient having neuro issues secondary to nutrition might have mental slowness, decreased alertness. They might exhibit slower muscle response times. Some patients that we take care of that have too much sodium in their diet will lead to hypertension, increasing the likelihood for potential stroke. Obviously, stroke having a massive impact on the neurosystem. Other vitamin deficiencies we might know will lead to patients having anemias, potentially mental health issues such as depression, and overall decreased nerve function. Moving on to the cardiopulmonary, really with the emphasis on the cardiac system, substances from fat cells produce certain changes in the body which can lead to atherosclerotic plaque or heart disease. And if not contained, and if those high levels continue of fat cells, it can lead to serious things such as myocardial infarction or a heart attack. Looking at it from the lens of the gastro system, or GI, you might have patients who have problems with swallowing or have some type of dysphagia. This can impact if they're not eating as much nutrition or taking in the proper nutrition simply because they're having so much difficulty swallowing. We might note secondary nutritional issues. They might have malabsorption issues that could impact nutrients actually being taken in. So these people or these patients would potentially be taking in the right amount of intake, but somewhere along the GI system, it's not properly absorbing those nutrients. That obviously will lead to nutritional imbalances and even weight loss. Other GI issues could be fatigue, secondary from GI upset, and we might have vitamin and nutrient deficiencies from any of the ones that we just talked about. So lastly, let's look at the impact of nutrition on the musculoskeletal system. Sustained poor nutrition affects bone structure. Think vitamin D. We know that vitamin D is needed to aid in the absorption of calcium to prevent bone loss and increase the bone's overall strength and density. We also need phosphorus, calcium, and magnesium in different variations for healthy muscle and bones. So if we're having any type of absorption issues or lack of intake, it can impact the musculoskeletal system. So let's talk about metabolism now. So when we look at metabolism, there might look at an imbalance of hormones and enzymes. Let's talk about diabetes, a very popular one that you'll hear throughout your nursing process. And unfortunately, this is a heavy incidence in the United States, so you will have plenty of experience and learning opportunities within the diabetic community. Diabetes is failure of the pancreas to produce the adequate amount of insulin to regulate glucose levels throughout the circulatory system. If not controlled, it will increase entry of sugar into the cells, which can destroy them and cause plenty of issues. Patients with sustained, uncontrolled, high diabetes will develop issues up to and including vision loss, up to total blindness, renal impacts, including all the way up to renal failure, neuropathies, which is impact of sensation and feeling often in the hands and feet, and they will exhibit poor wound healing. Food allergies. These, if depending on the severity, can be acutely life-threatening. Food allergies and food intolerances are slightly different. So let's talk about allergies first. Food allergies are the immune system's response to food intake of a particular food, and it is an inappropriate response. It treats it as if it is a deadly virus or bacteria, and by attacking it, it puts the body into a state of total shock. Simply put, the immune system goes nuts. So your most common allergies, pun intended, could be nuts, fish, shellfish, popular tree nuts such as like pecans and almonds, and we're seeing increased incidence in food allergies towards wheat. So a little more mild, but in the same umbrella, if you will, food intolerances, they're going to trigger a response from the body that's just going to be discomfort and annoying and aggravating, right? These are not life-threatening, but still the body is having an episode or a response against something we can all agree it probably shouldn't, right? So food intolerances trigger a digestive system response, resulting in the GI tract being unable to digest or break down the food properly. Popular one you'll hear that would be an example is lactose intolerance or a food intolerance towards dairy intake. Obesity. So obesity, by medical definition, is broken down kind of in ranges based on BMI, which we'll go over here now. So your BMI rating, if it is 30 or greater, you are going to be considered obese. Now, a way to remember this for nursing and a simple way to describe it to your patients, as your BMI rises, issues arise. So as your BMI rises, your blood pressure rises. As your BMI rises, your cholesterol rises. Now, men and women will exhibit this, especially chronic BMI issues, differently. Men and women, for instance, we'll say men will potentially have hypertension. They might exhibit hyperlipidemia. They might have both. Women, though, interesting stat, women are 4 times at risk for hyperlipidemia and hypertension than men. Fun little trivia fact there for you. So, factors affecting our nutritional status. So, simply looking at where the patient is in the developmental stages, how old they are, what developmental stage are they experiencing currently, will impact nutrition status. Different stages show different nutritional needs and eating patterns. Obviously, when judging at the one end of the spectrum, an infant will have totally different developmental stage impacts on nutrition, eating breast milk and formula, versus a geriatric patient that is in a different developmental stage that might be having nutritional changes as the body ages in the bones, teeth, and the rest of the body adapt. Lifestyle choices have a major impact on our nutrition status, our lifestyle choices. And this is a wide variety that there's no possible way to cover all of them. But we'll look at some of the major lifestyle choices that we'll see as a theme across most of our patients and how it potentially could be impacting their nutritional status. Dietary patterns is one. So the amount of food matters just as much as the type of the food. You could be eating some of the best foods, but overeating them. Again, we talked about overnutrition, creating an excess to the point where all those healthy foods you're eating are now detrimental. Whereas the flip is you could be eating only junk food and eating in small moderations. Well, you're still only eating junk food. So the body would be impacted differently there. So those are some dietary patterns. Think of the work environment. That's another one that's popular. So maybe pressures of work can decide where our patient eats. Maybe they work in a high stress, high moving environment where there is no quality food around and they're forced to eat fast food, convenience food, because of the pressures and demands of their job paired with limited break time. Another lifestyle choice is the mode of cooking or the cooking method. How we cook our food. Do we boil it? Do we bake it? Do we fry it? All will impact our nutritional status based on some of those choices on how we choose to prepare and what we put in our food. Some of our patients may be taking things such as oral contraceptive and other medications. Those oral contraceptive medications, as a theme, lower and impact vitamin C levels and several of our vitamin B that is throughout some of the water-soluble vitamins. This is something we might need to understand if we're noting that a patient is having something show up on their nutritional screening and they're also taking oral contraceptive. We'll talk about two more that are obviously something that we will experience in American society and then move on. One being tobacco use. Some things that healthcare providers take for granted is extended use of tobacco regularly impacts vitamin C, and smokers actually tobacco users burn vitamin C faster than non-smokers. So low vitamin C could be secondary due to their tobacco use. Another one is alcohol. Obviously, we talk in length about how excessive and over alcohol use can lead to a lot and a large variety of issues. But looking at it from a nutritional standpoint, not only are those impacts there, but there are actually quite a bit of calories involved. So your average 12-ounce beer is 150 calories per can. That's still calories that the body has to use, store, and burn through. So from that lens, there's also dietary and nutrition impacts there. Moving on to cultural and religious practices. So the food choices are usually indicative of a person's region or areas in which they have lived. Religious influence may also require a nutritional demand that we need to take in consideration based on the patient's religious beliefs. For instance, some religions may require fasting or abstaining from certain food groups altogether. And again, that could be something that we as nurses weigh into some of our clinical decision making and care planning for the patients. Let's talk about medications. So certain medications taken for particular diseases may affect nutritional status. So some of the side effects and byproducts of the medications we use can show up on nutritional screening and some of our nutritional assessments. Special diets are something that we will see, especially in the acute inpatient setting, everywhere. So a popular one, nothing by mouth, or NPO as it's abbreviated, quite literally means no food or fluid by mouth for that patient during their NPO status. We'll see some of our patients that are what's called a regular diet, often called a house diet, and that means they have no special restrictions and can eat based on their own preferences and taste. Most regular diets are agreed upon to supply 2,000 calories per day. So when we see regular diet, that is one assumption the nurse can make unless specified otherwise. There's other special diets that are modified by consistency and the preparation of the food based on if the patient has any dysphasias or diagnoses that actually impact how they can mechanically process their foods. And others are broken down by maybe the sodium, think cardiac diets. So let's dive in and look specifically from the lens of the nurse. So nursing assessments, what are some of the screenings we can do in this arena? So we can screen a dietary history. We can create a picture of the patient's food habits and their overall eating behaviors. Two popular ways to do that are a 24-hour recall and a food diary. We'll talk about the 24-hour recall first because it names all of the patient's foods eaten within the last day, as stated by the name, 24-hour recall. It's very simple, and it may actually be hard for some patients that have short-term memory problems. So take that in consideration when screening your patients. Family and loved ones available can always help and recall if they're heavily involved in some of the dietary decisions of the patient. So let's compare that to a food diary. A food diary is going to be more intensive and accurate. It's going to provide info on quantity as well as quality of foods eaten. You would keep the measure and record and weighed amounts of all foods eaten within a specified length of time. This could be a diary for anywhere from a week on out to months, maybe even a year, depending on how intensive and what's going on and why we're documenting. What's the rationale for watching our food intake so close? So a nurse has the ability to complete a mini nutritional assessment. It's often a standardized form based on conjunction of your facility and your nutrition and food service. It's a one-page form often, and it's great for some of our older adults. It really looks at all of the potential food options they have and what their intake is looking like. We reference BMI, or body composition, your body mass index, your BMI. So it has a wide range, and we'll look at that at a high level together now. So a healthy BMI, a healthy weight, is going to weigh or is going to range anywhere from 18.5 to 24.9. Once you hit 25 or higher, you're going to be categorized as having a BMI of overweight. Overweight specifically ranges from 25 to 29.9. You'll notice a theme here of we're going to start going in intervals of 10 from here. So overweight is 25 to 29.9. From that, we're going to go every 10. So obese class 1 starts from 30 to 34.9. Apologize, I said 10. I meant to say 5. Apologies there. Your obese class is going to be Class 1, 30 to 34.9. Your obese Class 2 goes from 35 to 39.9. And lastly, your obese Class 3, or morbidly obese, is any BMI greater than 40. Your textbook breaks down a really good way to calculate your BMI. Your BMI is the weight in kilograms, then divided by inches that have been converted to meters. So a good way and a good example will be broken down actually in chapter 6 of your textbook for those that need to see the math kind of worked out in the visual presence. So let's talk about things we'll see in the nurse's physical assessment or the physical exam. It's really tough Sometimes to catch these, especially if it's a patient that you haven't seen for an extended period of time or you're not familiar with. So the physical exam is a general survey. We might note alterations in vital signs. The nurse could potentially note poor skin turgor, which would cue in maybe a nutritional status impact. We might note extended or lack of wound healing. We might note a concaved abdomen, or we might have fluid excess noted via our general physical exam, such as ascites. Lastly, a nurse may note change in muscle mass and overall muscle tone of the patient if we're familiar with them. So nutritional labs, we'll talk about this at length and break down what some of these labs indicate and from a slight physiological lens, what's going on. So blood glucose indicates the amount of fuel available for cellular energy. We want to see our patient's blood glucose range usually to fall anywhere between 60 and 110. Prealbumin and albumin, one being prealbumin, is shorter half-life. So the half-life of a prealbumin is about 2 days, whereas the half-life of albumin is somewhere between 20 and 22 days. When you look at them together, they help determine the recent nutritional levels, and they measure the amount of protein in the internal organs. Transferrin is utilized to transport iron into the body. Transferrin increases when iron levels decrease. That would make sense, right? We're going to get the transferrin up so we can increase iron transport into the body. Transferrin is elevated during fasting, chronic infection, inflammation, serious burns, and pernicious anemia. BUN, or BUN, is used to determine how well your kidneys are working. BUN really hones in and gives us a good view of the renal system. Creatinine will have increased levels that may indicate loss of muscle mass, and it's primarily used to impact kidney function. So creatinine is also another one we're really looking at that renal system. Hemoglobin and hematocrit. Hemoglobin is made of iron and protein. A low hemoglobin would cue in the nurse that maybe inadequate iron intake or chronic blood loss could be occurring. We might note fatigue, shortness of breath, rapid respiration with low hemoglobin levels. And hemoglobin is usually, when in normal range, hemoglobin is usually 1/3 of the patient's hematocrit. So hematocrit is the volume of blood. It's going to be indicative of fluid status. So low hematocrit may be indicative of anemia, and our fluid status and dehydration is being impacted. For this, we want to see the patient's range be somewhere between 35 and 45. So let's look at some of our nursing diagnoses that we might work through with some patients that are having nutrition problems. Again, we talked about it at length, especially in the American population. A popular one you will see is obesity or risk for being overweight. We might note impaired nutritional intake. If our patient has a primary diagnosis that impacts their ability to feed themselves, they might have impaired self-feeding, or for the dysphasias we were talking about earlier, you might have impaired swallowing. So the etiologies of nutritional problems that we see. Let's talk about those that are going to stem from undernutrition. Undernutrition may cause psychological, social, economic, or physiological impacts that impact the body and lead to undernutrition. So consuming insufficient intake of protein, fats, vitamins, and minerals is undernutrition. nutrition. When you have a state of undernutrition, you are consuming less calories than are needed according to your activity, weight, and height. A person can be malnourished with regard to specific nutrients without being underweight. Let's talk about overweight. Overweight currently affects 2/3 of the adult United States population. Overweight is associated with chronic diabetes, hypertension, coronary artery disease, and potentially obstructive sleep apnea. A person who is 40% overweight is 2 times as likely to die prematurely as a normal person within normal weight. Now, that sounds doomsday and alarming, but it's actually very true. The body is not designed for sustained periods of being overweight. Too many nutrients than what's actually needed. The body gets forced to store those, and it simply put, for a long period of time, it causes a lot of stress on the body and leads to a lot of disease processes. It's very hard on the heart and the kidneys. Moving on, talking about self-feeding. So we can look at patients that would have issues in our time with them during an inpatient stay, whether that's inpatient acute care or even long-term care. We would notice maybe they've had a CVA or some type of spinal cord injury. This would obviously have motor and sensory impacts stemming secondary from their disease process. So these patients will potentially need more hands-on care, if not total care, in regards to feeding. Patients might have swallowing difficulties that are residual from some type of neurological problem. Think CVA. They've had some type of brain injury that has cut off the part of their brain that operates how they properly swallow once food is placed in the mouth. Another disease process that has a heavy impact on swallowing difficulties is Parkinson's disease. So some of the nursing interventions we can have for patients with impacted nutrition. So the nurse can teach and educate. They can teach the importance and ranges of vitamins and minerals. They can give an overview of supplements. And if intense questions continue, they can even make a referral and recommend for a nutritional specialist. Nurses can talk and educate about nutritious foods. They may explain that elderly may need to get one hot meal at noon at community living centers, whereas disabled ones may be having meals delivered and funded by public and private partnerships. The nurse can talk about special diet orders. The nurse can educate and teach on a clear liquid diet, often utilized for short periods of time, and it can include clear juices with no pulp, water, broth, clear soda such as ginger ale and Sprite, popsicles, gelatin, and tea and coffee. The patient could be educated on a full liquid diet, which becomes full liquids at room temps, still juices without pulps, but now we can have milk and milk products, yogurt, strained cream soups, and liquid dietary supplements, such as like the popular brand Ensure. A pureed diet is blended. It is made into a pulp-like mixture, and people who cannot safely chew or swallow solid foods may be able to be placed on a pureed diet. We talk about providing a clean environment. So when these patients need assistance with any food, they obviously need prep, both pre and post meal, cleaning themselves up, and mouth care may be provided for patients that are unable to go ahead and provide themselves simple things such as brushing their teeth or mouthwash. Some more nursing interventions, we might have positioning. So we could potentially have the head of the bed anywhere from 45 to 90 degrees, allowing for a safe environment for swallowing. The nurse can provide assistance with eating. They can watch for problems with eating. They can make sure that the patient isn't pocketing food or storing food in areas such as the cheek in between the teeth and gums area. They can monitor for excessive chewing and maybe even gagging when the patient is trying to swallow a regular diet. And we can also provide support and management for nausea. There are a lot of different pharmaceutical inventions depending on what the patient has going on. So let's switch gears and talk about enteral nutrition. It is simply providing liquid nutrition into the upper intestinal tract for those who cannot meet their own nutritional needs. We'll talk about the small bore NG tube. The small bore NG tube is used for short-term use, and it places the food in the stomach. A nasoenteric tube is short-term use, but it's longer than an NG tube, and it actually extends into the duodenum or the jejunum, and it has a decreased risk for aspiration. Let's talk about a PEG tube. A PEG tube is surgically placed into the left upper quadrant of the abdomen. A PEG tube is well tolerated for long-term nutrition. It's easy to use and it has low incidence of complications due to its makeup and location. A PEG tube has decreased aspiration pneumonia risk. It's cost effective, especially for long-term care use. Post-care that we want to examine for this PEG tube area is examine the skin for any type of irritation or breakdown. We want to clean the stoma with sterile saline and then dry with gauze. And we'll maintain this view and safety usually about 10 days after placement. Then they won't have to use the sterile saline as much. It just becomes a regular monitoring, and from there you really just look to make sure that there's no difficulty or impact long term. Once the patient is used to and has had a PEG tube for an extended period of time, it's a lot less of risk for issues as far as irritation and infection after placement. Indication. For those that cannot handle a regular dietary regimen, such as a patient who's had a stroke or other disease processes that have caused decreased nutritional status. For formulas, we have different, and there's a large variety. We have high protein. We might give high protein formulas for patients that have experienced burns, or they have open wounds that are requiring a lot of healing, or for patients that have malnutrition. They might use elemental formula, which is, it contains amino acids and it's fiber free. It's used with severe small bowel obstructive dysfunction. And this is controversial. You really don't see a lot of elemental formulas utilized. It would be very rare that you will experience this in your nursing practice. You might have diabetic formulas. This is going to control the carbohydrate intake. These patients we have to keep a much closer eye on because remember their pancreas is being impacted. And this is for type 1 and type 2 diabetics. They'll have different diabetic friendly formulas. You can experience renal formulas. For patients that have renal failure or renal insufficiency, this formula limits the amount of potassium, sodium, and limits the nitrogen intake. Two more that we'll talk about will be a pulmonary formula, which provides 55% of the calories as fat so that less CO2 is produced. And this formula will be used for enteral nutrition for patients that have some type of lung disease. And the last one that we'll see are fiber-containing formulas. These are used for patients in long-term care facilities or patients that require enteral feedings for prolonged periods of time. The last bullet point we want to look at is safety. When utilizing enteral feeding, be alert. We're going to use aseptic technique when preparing formula and use proper hand hygiene. We're going to label the equipment, and we're going to elevate the head of the bed above at least 30 degrees, so we're not having any risk for aspiration. Much like a medication, you're going to verify that you have the right patient, the right formula, the right tubing, and the right equipment to administer it appropriately. And you're going to trace all your lines and tubing to the patient to make sure that there's no damaged or obstruction equipment. The last area we're going to talk about during this lecture is parental nutrition. So some of the indications for this are for patients who cannot be fed through the GI tract. They are severely malnourished, and they are probably a patient that's been diagnosed with an extensive trauma or extensive burns. These are conditions that require the GI tract to rest, but the body still needs the proper nutrition. We'll need to get access devices depending on what type of parental nutrition is being utilized. We might have a large high flow vein, such as the subclavian vein or the jugular vein, with a central venous access catheter. Another line that you'll often refer to is the PICC line, PICC, and that's the peripheral inserted central catheter. These can both be utilized for parenteral nutrition. Types of solutions that we might give, they will range anywhere from 10 to 70% of dextrose in water. Usually it's lower, closer to 20% though, along with amino acids, vitamins, trace elements, and minerals. Safety concerns to consider with this group is we will have placement confirmed through an X-ray. You're going to assess these lines for infection continuously. We're going to take daily weights to monitor fluid intake and output, and we're going to weigh the patient regularly. We're going to have intake and output, and we're going to monitor and track this throughout the patient's stay and while utilizing parenteral nutrition. We're probably going to have orders for regular lab values for electrolytes, glucose, BUN, creatinine, albumin, prealbumin, your CBC, and other liver function studies. Special considerations and orders will need to be followed based on the type of dressing in your facility's policy. Often you'll see to change the dressing of every 24 hours or more frequently per policy when the bandage becomes wet or soiled. When changing, we must use sterile technique and make sure all of our connections are secured. This is Module 6 here at Aspen University, and I hope you got something from this lecture today. Thank you.